My name is Anjana, research scholar in IIST Trivandrum, and today's IEEE CSS GSAC the research scholar talk, title named Simulation and Analysis of an Integrated Cardiopulmonary Gas Exchange Model under Different Pathological Condition. This is the published paper in IEEE Access. The citation details are also given in this site, and this is the overview of my presentation. So the motivation, the what is the main reason for to choose this kind of areas? We know that in cardiovascular diseases and pulmonary kind of diseases are a major health issues in worldwide. So when we want to analyze the medical measurements and all those things, then directly measuring all those values, physiological parameter and everything, there will be a lot of limitations, mainly time consumption and then the cost, everything really matters for that. And also when we need to do some clinical trials on certain kind of diseases like that, if we need to try on some illness people cases, then it will be a life threatening risk for them. So there will be a lot of problems related to the clinical trials and measuring physiological variables and all those things. So this necessitates the need for mathematical model. If we have a proper model of a human body in which whatever be the kind of analysis we can do, we can analyze in that mathematical model, and the mathematical model will provide the all the physiological variables and everything, then it will be a good achievement for the biomedical related areas. So this is the main reason for the mathematical modeling part. And then definitely when we have a proper mathematical model, early disease diagnosis and then proper analysis for any kind of diseases can be very easy with less time, and then with efficient method we can do without risking any other individuals. So this is the main reason for to choose this kind of area. So from the lot of literatures has actually most of them have done a lot of researches in this kind of areas, and then they have developed a lot of models also. But some models restrict the mathematical part in a some where some simplifications are done. Actually, they didn't completely integrated the heart and lung interactions properly. So there the need for a comprehensive cardiopulmonary model that can account the entire cardiopulmonary mechanism along with the controlling part, that is the receptors influence also. Then when we have the proper comprehensive CP model, then the further analysis for different kind of diseases such as pulmonary and then heart related diseases we can do with this kind of model. This is the main objective for this area. Then the mathematical model. Mathematical modeling is done using the Windkessel model. In Windkessel model, it is the electrical representation of physiological parameters. Actually, the opposing properties will be represented by using resistance. Initial effects are represented by using inductance, and then the storage capacity is represented by using capacitance. So the entire physiological network will be represented in an electrical circuit way, and all the pressure, flow, volume, all those represented in the electrical terms. And then we can have a proper mathematical modeling, and also the linear, non-linear dynamics, everything is also taken into consideration. And then here atrial contraction is also considered in this one. This is one of the novelty that we are giving in this paper. Then this is the overview of the entire mathematical part. This is a very simplified block diagram in which including the mathematical, general mathematical formulas only. So here we can see that the heart model is controlled by using baroreflex, and then the main general parameters and the equations like pressure, flow, volume, all those are included here. Similarly, we can see that the lung model, in the lung model controlling by using respiratory control, that is chemoreflex control, and also the gas exchange model in which how the input oxygen carbon dioxide concentrations and how the alveolar level oxygen carbon dioxide can be determined. Very control things and basic general equations also integrated in this block diagram. Then when we come to the pathological condition, there are a lot of diseases. Now for this case, we have included certain kind of lung diseases, and then different pathological conditions such as one is hypoxia. Hypoxia means that it is the lack of oxygen in the tissue level. So when we need to simulate it, how we can simulate it is, it is like the inspired oxygen normal level is 21%. If suppose the oxygen percentage is reduced to 7 to 9%, then then definitely the tissue level oxygen also will get reduced. This is how we have done in the simulation. Inspiration oxygen level we have reduced to 7 to 9%, keeping the carbon dioxide level as the usual value of 0.04%. In the case of hypercapnia, it is the reversal. It's like a carbon dioxide level in blood will be more than 45 mmHg. For to get in simulations, how we have done is that oxygen level we kept as 21%, and then carbon dioxide level we increased to 5 to 7% instead of 0.04%. Similarly, in the case of lung disorders like chronic obstructive pulmonary disorder, it's like an obstruction in the airway structure. So this is done by using, in mathematically, we have simulated the upper airway resistance equations. In these equations, there is a parameter called a Ku. When we vary the Ku, the upper airway resistance also will vary. So it will create an obstruction to the upper airway. Through varying that parameter Ku, we can analyze the different kinds of COPD levels. Then similarly, pulmonary fibrosis, that is also another kind of lung disorder. It is like excessive fibrotic tissue deposited in the lung parenchyma. Actually, it's like an alveoli thickness will be increased. So to do the simulations in that one, the alveoli complaints and then elastance, there is a parameter called KL. We are varying the KL in such a way that the same way of severity level in PF pulmonary fibrosis can be analyzed. And then the mathematical model, we need to do the analysis whether the model is actually a replica of our human body, human cardiovascular, cardiopulmonary system or not. To analyze that one, each main figure, pressure, flow, all the values are checked and then analyzed, and this table clearly show that we can clearly see that the all the systemic artery and the left ventricle, right ventricle, pulmonary side arteries and veins, whatever be the pressure values we are getting in model, the same it is actually lying in the same normal range for a human body. So it really says that the cardiovascular system model is a replica of our human cardiovascular system. And then in the same case we need to do for the lung model analysis. Here lung we have considered the upper airway, smaller airway and collapsible airway, that also marked here. And then the pressure and flow volumes corresponding to each of the sections is also given in this one. From here we can see that the dead space volume is actually 50 ml and the total lung volume is 600 ml and then alveolar volume is 550 ml. It is usually stays in the normal range of tidal lung and the space volume. So we can say that the lung also performs the similar way as a human lung. And then definitely we need to have an experimental validation for that. So for that what we have done is actually we have taken the experimental data and then we compared with our model result and also existing model results. So the results actually here the cardiac output and then right ventricle output and also systemic artery airflow rates are so compared and the root mean square values also given here. So from this table we can clearly see that the proposed model really performs well because the root mean square value for all the values are very less compared to the existing model. It really shows the accuracy of our proposed comprehensive CP model. Then the pathological condition analysis in this case. We have mainly focused on two pathological conditions such as hypoxia and hypercapnia. As we discussed earlier, in the case of hypoxia, the oxygen level we are reduced to 9% in the first case instead of 21%, and then later on it subsequently reduced to 8 and 7, and then we have observed the oxygen pressure variations according to that one. In the case of a hypercapnia, similarly instead of oxygen we are increasing the carbon dioxide to 5 to 7% instead of 0.04%, and the corresponding alveoli oxygen and carbon dioxide pressure values are monitored. To get a proper understanding, a quantitative analysis is done and it's tabulated in this one. So from this table, it's clear that in the case of a hypercapnia, that is like our carbon dioxide level, inspiration level, we are increased to 5 to 7% instead of 0.04%. So we can clearly see how the carbon dioxide level is increased from usual 41 to 48. And then we can also observe that here there is a central receptor and peripheral receptor. In the central and peripheral receptor are the chemoreflex control mechanism to control the blood oxygen carbon dioxide level. Central receptor is the main receptor which is actually controlling the carbon dioxide level. So it can clearly observe that in the case of hypercapnia, central receptor is performing. It is actually acting the control mechanism and it is trying to maintain. But in the case of peripheral, it doesn't have much variation because oxygen variation is less compared to carbon dioxide level. Similarly, in the case of a hypoxia, the oxygen level we are reducing from 9 to 7% instead of 21%. So clearly we can see the reduction in the oxygen level from the normal range. Instead of 123 to it is reducing to 100. And then we can, so from here also we can see that the central receptor is not much important, but peripheral receptor is actually acting in this case of oxygen reduction thing. Then comes to the diseases COPD. Here we have mainly focused on two kinds of lung disorders like chronic obstructive pulmonary disease and pulmonary fibrosis. So in the COPD case, actually we are changing the upper airway resistance to different level. We are increasing the upper airway resistance to certain level so that we can say that COPD severity can be analyzed. So similarly, in the case of a pulmonary fibrosis, the lung elastance property, that is means that alveoli thickness elastance property parameter KL we are varying so that we can check how it acts and then how the oxygen carbon dioxide level will be changing. So from this figure we can clearly observe that here the COPD case we can see that the upper airway obstructions with a varying KU from 0.46 to 10. So from here we can clearly observe the oxygen and carbon dioxide, how much oxygen reduction and how much carbon dioxide increase is happening, and then lung volume and airflow rate variation is also clearly observed in this one. Similarly, in the case of pulmonary fibrosis also, the lung alveoli thickness we are increasing by changing the value of KL from 0.75 to 1.3. So here also we can clearly observe that oxygen level reduction and carbon dioxide level increase, and similarly that total lung volumes reduction happening according to the PF. So this clearly reflects actually the severity level of two kind of lung disorders like COPD and pulmonary fibrosis. So when we need to analyze different kind of any kind of disorders like related to lung or heart, we can do this kind the analysis using this model. So the model will say clearly how each all the physiological parameters will vary according to the diseases severities, so that the precautions can be taken according to that one. Because we can see that suppose if any COPD happening, it's like an obstruction to 15%, how much oxygen reduction will be happening. So if the oxygen saturation level goes below 90%, it clearly means that oxygen therapy should be required. So artificial oxygen should be provided for those patients. So it will be clearly beneficial for the medical practitioners to do precautions to be taken for any kind of diseases according to their specifications. So this one we can integrate it with a lot of other data like patient specific data and also some hormonal impact and all the other things. When we integrate, definitely this will be a very helpful part for the medical practitioners and the normal human individuals also. A pulmonary analysis can be done with this model itself. So thank you, and then if you have any doubts.